Hello and welcome. Today I thought we'd talk about the liver and liver disorders. Hey, that's a big topic. I mean, you're talking about a lot of different things, but it would be a good time just as an introduction to see what's involved with different types of liver problems. And at a later date, we can tackle each of these individually. So the liver, just like every other organ in the body, is very, very important. It not only is like a factory, it manufactures things, it regulates things, it helps in your sugar, your fat, your metabolism, but it's also a filter. So everything that you eat and everything that passes through your gut that's absorbed filters through the liver. So it removes toxins and it removes unwanted things. And it only allows the substances that you need to be absorbed and go into your circulation. So it has a very, very important function. Now, one of the things about the liver is when things go wrong, it doesn't necessarily present itself very early. In fact, you need about 70% of the liver to be damaged before you start having symptoms. So that's why you have to be extra careful to not aggravate it with unwanted things. So when we talk about some of the disorders of the liver, we can talk about viral illnesses. For example, hepatitis B and hepatitis C. These are two big global problems. Hepatitis B, usually the body can fight against it 90% of the time, but about 5 to 10% of the time it can be chronic. And the inverse for hepatitis C, which usually is chronic, and only a small amount of time that the body can actually fight against it. We have vaccinations for hepatitis B, which have been very effective. And there's no vaccination for hepatitis C, but the medications, although very expensive, that we have now are extremely effective. But these are two big global problems. Second is metabolic disorders. And here we talk about autoimmune disorders, such as, well, primary biliary cholangitis is a name for it, but there are other things such as some other autoimmune problems and disorders that are very specific. There's fatty liver disease. Now, there's two types of fatty liver disease. One does not cause a problem, where you get a lot of fat in the liver, and the other does cause problems. This we call non-alcoholic steatohepatitis, or NASH is another name for it, NASH. So you have fat in the liver, and it causes inflammation, and with time you can get fibrosis, scar tissue, and it can lead to cirrhosis. One way of distinguishing these two is that usually with NASH, your liver function tests in your blood work are elevated, but not all the time. That's usually if a patient has a fatty liver, let's say on ultrasound, and you have liver enzymes that are elevated, there's a reasonably good chance that that is from NASH. So other disorders, well, there's something called hemochromatosis, which is a hereditary disorder where you have too much storage of iron in the liver. And the treatment for that is really simple. You just have the patient give blood intermittently. And you obviously want to make sure there's no tumor in the liver. And there's also a lot of medications that can affect the liver, because everything gets filtered through, but there's some that can cause chronic injury to the liver. So these are just some of the disorders. There are many more, obviously. But when we think of the liver and liver disorders, these are some of the things that we want to that we look into and want to make sure that are not involved. So what can you do for diagnosis? Well, one is laboratory testing. You look at your liver function tests, and you also look at some other disorders that can affect the liver. Well, the thyroid can affect just about anything, but you look at that, and you look at also the medications that the individual is taking, and so forth. So you want to get a very adequate history. You want to do a good blood work, and with your blood work, especially if your liver enzymes are elevated, or if the patient's elevated liver enzymes, we usually do a metabolic workup, and we look at their serum iron levels, and we look at their total blood count, their coagulability, and so forth. There's certain specific things that we do ask for, especially if the individual has elevation in their liver enzymes. Then you can do, well, you do an ultrasound. A lot of times they've already had it by the time they come and see us. There's something called a fibroscan. Very simple to do. Just takes a few minutes. And what it does is it's almost like an ultrasound, but it's simpler. And it tells us if there's scar tissue in the liver. You can do that in other forms of radiology as well, like with MR, but this is the simplest way. And you can do a liver biopsy. What that is, and especially if they've had liver enzymes that have been elevated for a long period of time, we basically freeze the skin with a thin needle. You just go in and out, and what's on the tip of the needle is basically your biopsy. So it's not really a big cut thing. It's just what's on the end of the liver, end of the needle. And under microscopy, we can obtain a lot of information from that. So treatment is according to the pathology. I should mention, I don't know if I mentioned alcohol, but that's one of the main culprits in involving the liver, just like it can be a culprit in many other things. And don't forget that, like I mentioned before, that the liver is very good in hiding itself until about 70% of it is injured. So you don't want to wait to that point, because everything lets loose at once, where you get fluid building in your belly, and you can get something called encephalopathy, and you can get varices in your esophagus, and so forth. So you don't want to get to that. So you have to really be careful about alcohol intake. And also don't forget that females, just from the biology, have a much higher risk of getting liver injury with much less alcohol intake. So let's not forget about that. So one thing is lifestyle management, making sure that we don't take things that are going to aggravate the liver, such as excess alcohol or certain medications that may be the culprit at the time. And if we have a diagnosis, then maybe we can give medication. And obesity, although is involved in NASH, you can have NASH without obesity too, but obesity can cause fatty liver, but it can also cause many other things. So weight loss, dietary management, exercise, these are all important. So hopefully at another time we'll try to tackle these different disorders one by one. And for now, that's all I had to say. Have a great day.